Medication Administration Part 2, Introduction to Nursing Concepts, Martha Olson. This is Chapter 31. When we look at the routes of administration, it's for the prescribed medication. It depends on the properties, the desired effect of the medication, and then the patient's physical and mental condition. The route of administration for a hospice patient might be topical because they're unable to swallow and they're unresponsive. For a patient that has nausea and vomiting, we may administer a medication rectally. In the hospital, most of the patients have an IV, and that's the easiest and quickest way to administer a medication. For the oral route, it is the easiest and probably the most common route for a patient that is able to swallow or does not have dysphagia. Oral medications have a slower onset of action and a more prolonged effect than the parenteral medications. Patients generally prefer the oral route. Parenteral medications involve giving an injection under the skin into the body tissue. The following are the four major routes or sites of injection. Intradermal is just into the dermis. You've probably had a Manteau test where they had to do that. A subcutaneous injection is into the tissue below the dermis. The most common for that is your insulin. Intramuscular is into the muscle, and we'll talk about the 3 or 4 sites that are appropriate for an intramuscular. And your intravenous, which is not included in this. We will have a whole 11-hour unit on the IV medication into the vein. Some are administered into other body cavities, such as an epidural, intrathecal, intraosseous, intraperitoneal, intrapleural, and some of those are not within the scope of practice to administer them, but we are, as nurses, responsible to monitor the integrity of the medication that has been given if it was done by a nurse anesthetist or a physician. Medications applied to the skin and mucous membranes generally have kind of a local effect. So if I was going to have stitches, they may give me some lidocaine locally to kind of numb the area where I need the stitches. Systemic effects often occur if a patient's skin is very thin or broken down. When we look at administering medications into the mucous membranes, we do it in a variety of ways, either the direct liquid or ointment. Into the body cavity, we can instill fluid into the body cavity and have them retain it like an enema. Irrigating the body cavity where the fluid is not retained, or spray the medication into a body cavity. The deeper passages of the respiratory tract actually have a large surface area. During a code blue situation, if we do not have an IV in place, we will use the respiratory tract with its very vascular access to administer medications and ventilate them to get the effect of the medication from that route. We also think of your inhalers and your breathing treatments as a route of administration for that effect. And then intraocular medication is similar to having like a contact lens into the eye. The medication disc is like 2 soft outer layers that have the medication enclosed in them. So when we talk about all of the different routes, we look first of all at the oral route. We can either have a buccal or sublingual. Sublingual then is under the tongue. It's very vascular and has very quick effects. The most common medication that we give sublingual is the nitroglycerin when somebody's having a chest pain. Some medications are readily absorbed after being placed under the tongue. Administration of a medication by the buccal route involves placing the solid medication in the mouth against the mucous membrane of the cheek until it dissolves. Warn the patient not to chew or swallow the medication. And a buccal medication acts locally on the mucosa or systemically if it's swallowed in the saliva. Here is your endotracheal route. So a patient that's in a code blue situation might get epinephrine given via the endotracheal route. This is the picture from page 573. In looking at systems of medication measurement, then you're going to have to refer back to your dosage calc class and be able to correctly administer medication dosages. You have to be able to compute them depending on, is it milligrams or milliliters. We use the metric system because it's the most logical. We try to avoid the household system of teaspoons and tablespoons because there's a lot of inaccuracy with those types of household system. With our metrics then, we have the gram, we have the liter. We remember to use the lowercase for abbreviations of milligram, and milliliter then has the small m, the large L. And our dosage fractions then are done so that we do not wind up with a half of a gram, but a 0.5 gram type of dose. Our nursing knowledge base then, we have to be safe practitioners or we can kill patients. And so we are very specific in knowing how to administer and what is a safe dose. We may have to figure out how many milligrams per kilogram based on weight. And so knowing how to take a patient's weight in pounds down to kilograms is going to be a conversion you will use quite often. In 2003, the Institute of Medicine published a book, To Err is Human, Building a Safer Healthcare System, and in that book it looked at some of our awareness of the problems in the healthcare system, where we saw some 98,000 people die every year from medical errors that occur only in hospitals. This means that more people die from medical errors and motor vehicle accidents, breast cancer, and acquired immune deficiency. So we look at healthcare experts and they say that, we have to really work on medication-related errors in the hospital because they cost more than $3.5 billion annually. And because the nurse is the one that administers the medications, patient safety, especially in medication administration, is a key part of our jobs. You will get a lot of nursing questions on this type on your NCLEX because it has to do with safety. To administer medication safely, you have to have an understanding of basic math, how to calculate dosages, mix solutions, and then perform other activities related to safe medication administration, such as critical thinking, knowing when this would be appropriate or when it would not. They're not always dispensed in the unit of measure in which they are ordered. Medication companies package and bottle medications in standard dosages. So if you are having to administer 6 tablets of a medication, you should be questioning that because that would be probably too high of a dose. When we look at dosage calculation medications, we always want to work with another nurse if we at all are unsure about the accuracy of that. We want to use dimensional analysis because with dimensional analysis, our labels then follow us through that math problem, and we should come up with the correct label for that as well. Current evidence shows that nursing students who use dimensional analysis often calculate more accurately than when they use the formula method. I was taught on the formula method, and it has been a big switch for me to be thinking about how to do math problems in the dimensional analysis. We will be practicing this, so you will definitely want to pull your math book out and review how to do dimensional analysis to be a safe nurse and be prepared for that clinical math quiz that you have before starting basic clinical. The prescriber's role then can either be a physician, a nurse practitioner, or a physician's assistant. The orders usually are electronic now because handwritten leaves us room for error if we do not understand or read it correctly. Verbal physician's orders are not the best either because we need to do a verbal read back to make sure that we heard and understand them correctly before we write that down, and then over the telephone the doctor has to come in within 24 hours and verify that what we wrote down that we heard over the phone is indeed the medication that they want ordered. Avoid abbreviations because of the potential for error, and they need to include these things: the patient's name, the date it was ordered, the name of the medication, the dosage, the route, time of administration, drug indication, and then the prescriber's signature. There will be a test question related to finding a medication order that is not correctly written. The regulations for each healthcare institution for ordering medications should be written as a policy and procedure. Some prescribers use handheld electronic devices to order medication orders. And anymore, most of them, as I said, are computerized physician order entry. When we use abbreviations, they cause errors, so there is a list of do not use abbreviations that go along with this medication unit in the Potter and Perry. We will be moving on then to the types of orders in our Unit 3.